congratulations, ladies, on 1 year in practice in direct primary care.
Thank you.
Cheers.
So when you started a year ago, you had an idea about taking care of people a different way. How does the experience you've had over the last year compare with what you expected going into it?
I think that I expected it to be like other experiences that I've had where maybe you didn't have everything that you needed because you were by yourself, because I don't have a medical assistant, I don't have a secretary, I don't have an office manager. But what I have found is that I like it better because I have as much time as I need. If I want to take an hour, I can, or 2 hours, I can, or half an hour, I can. And I don't need all those extra people to do those things for me. I can manage the billing piece, and I can manage the medication piece, and I can manage the blood pressure and the weight, and I can talk to my patient while I'm doing that, and I don't have to put them in the front room and bring them in the back room and take them to the checkout, make sure they pay their bill, make sure they do this, because they're dealing with me, and that's it. Me, or Juana. And that's it. So I think that that's a welcome surprise for me because it feels more intimate and personal than an office setting does otherwise.
I really like the space we have. I find practicing in a very cozy, comfortable space appeals both to me and my patients. They are very happy. They want mainly time, and I'm giving them that. I also get to practice more autonomously. I feel that I'm able to address all the problems that are on their minds. I encourage them to ask questions. I encourage their loved ones to bring questions and to reach out whenever they need me. I make sure that if I'm treating a family, they all leave with a business card for both Jennifer and I to have, so they could have our phone numbers and reach us at any point in time if they have questions, and it works great. I feel that I am less rushed, I am less stressed, and I am happier. Like we did the other day, Jennifer, we were taking pictures 10 p.m.
Still seeing patients.
Still seeing patients, but were we happy?
Yes, we were smiling.
We were smiling.
Yes.
So I think that goes to say that this model works well.
Yeah.
What surprises your patients about the experience after they've had a couple of visits with you, or maybe even one? What do they tell you surprised them?
Oh, patients are always like, I couldn't believe you got me in so fast, or thank you for seeing me so quickly, or thank you for seeing me after work or on the weekend because I don't have time during the week. So that's one thing that I think patients say to me a lot, that our availability to see them outside of regular business hours is very helpful. That's one thing. The other thing that patients always say to me is, you listened to me, you took a long time with me, I appreciate you listening and hearing what I have to say and explaining what you're doing or why you're doing something. You take the time to teach me about the medicine you're giving me or the steps you're giving me to, make a better choice or something.
And that surprises? That surprises?
Yes. Oh, yeah. Because in other situations, they're used to going in a room and seeing a doctor for 10 minutes or an NP for 10 minutes where they're restricted to a schedule. And so it's, you have a sore throat. Oh, how are you? Okay, here you go. And then they leave. And there's no chance for wait a minute. I also have what about this?
The doorknob question.
Yes. And so this setting there are no doorknob questions. It's like, put everything on the table. Even if they forget something, because we're doing all of the stuff at once, they'll remember, while we're checking their weight or their blood pressure, I forgot to tell you I have a rash, or I forgot to tell you I have this or I have that. And so you can still address those problems when you're in the appointment.
Okay. What kind of surprises have your patients expressed to you, Juana?
Well, there's two things. But the one that surprised me is, it's great that you can do this for this price. Mm-hmm. Why can everybody else not do this? Mm-hmm. And the second thing is, how come the other guy in the box didn't tell me that? Mm-hmm. I would have stayed healthier for longer. So those are the two things. So it comes back to time. Having the time to teach our patients as to why they're getting sick and how to avoid those issues.
Asking questions.
And two, I love that they're like, hey, $75. Mm-hmm. And they stay healthy.
Right.
So it sounds like you like doing direct primary care. You like doing DPC.
Yeah.
I love doing DPC, and I encourage others to start practices to do the same thing. Like I tell my patients, If people want change, they need to change.
Mm-hmm.
Period. We can't just blame a politician. You just can't blame the healthcare system. If you want change, it should start with you.
And what do patients need to be bolder about?
Asking for what they want.
Yeah, getting the care that they need, asking the questions that they have, and demanding to get the time that they need with their provider.
Or finding someone who can.
Okay. Have you had any big wins? And not necessarily big wins for you, but big wins for patients in terms of taking care of people.
I think that on a whole, we've done a really good job of helping patients save money. So we purchase medications and have them here in the clinic. And so right now we have 69 different kinds of medications that we can dispense after we see a patient. And so over a year that we've been doing that, we've been able to save patients on an average per patient $140 on medications, which is a lot of money. So that saves them time and a trip to the pharmacy, and it saves them cash that they would spend at the pharmacy when they buy it from us. So I think that's a pretty big win, right?
What's the most fun you've had doing direct primary care?
I could tell you.
We have fun all the time, I think. Don't
For
we?
me, is doing skin procedures.
That
So
is
get rid
her
of-
favorite thing.
That is my favorite thing.
What about you, Jennifer? What's your favorite thing about doing DPC?
Oh, my favorite thing is that it's just so personal. So, like, my patients know me, and I know them, and they know that I run late, and so they'll text me and say, "Are you here on time, or should I run some errands?" But they still don't. But when I arrive, we have an hour and a half, so they don't care. You know, we drink coffee together. We talk about our families together. They refer family members to me, or back and forth, or so it starts to feel more like a family rather than like, oh, I'm going to the office to see 5 patients or whatever. I think that's the most fun that I have with it. Just
So,
feels personal.
Let's talk a little bit more about value. How's what you do different from what patients might?
So in this kind of setting, if somebody comes to me and they have a rash and I didn't fix it right, they can come back to me and say it didn't work, and I can try again. But in other settings, if they go and say I have a rash and the doctor didn't fix it, or the NP, they go back and they might get somebody different and they have to start all over, right?
Right. Now, who wants to come back that second time? I mean, a lot of people sometimes are a little bit suspicious of being told that you have to come back for a follow-up visit or a repeat visit. And they think, well, you're just trying to get another copay out of me or something.
Yeah.
Do you find that having a membership model makes that
Oh, yeah.
easier?
Well, there's no copay here. So I think that once patients see the value in paying a membership fee every month, that it gives them the convenience to be able to come and go if they need to. So when we say, hey, come back in 2 weeks, I want to check that again for you, it's more like, oh, she cares about how I'm doing and she wants to make sure that I'm better. Not, she just wants to collect my money because there's already a membership thing going. That's my perception anyways. And I think that patients feel that way too.
Yeah, so they know that if they want to come in, when we tell them to come in for follow-up, they're like, yes, of course I
Yeah.
want to take care of it, but they don't have to worry about that
Yeah.
next bill.
But actually, and also, in other situations, you might see a patient, and because you have your panel is so big or your practice is so busy, you might prescribe them a medication and then see you in 3 months, right? But in this practice setting, I'm not going to prescribe someone a medicine and say, see you in 3 months. I'm going to say, I want to make sure you're okay. I'm going to follow up with you in 2 weeks or a month or 6 weeks or whatever it deems. And so I think that the patient feels like, oh, they do care about how I'm doing. Not like you just throw them out into the deep water and wait and
Sink or
see what
swim.
happens. Yeah, they like that we follow up with them and check on them. And sometimes if I'm not going to see a patient for a while, I often will text them and say, hey, are you doing okay? Did you get better? Are you doing all right? And I think that patients really like that too.
Yeah, reassurance that we're there and reassurance that we are thinking about them and their condition.
How do patients react to some of the services that you throw in for free? EKGs, you know.
My patients, they are surprised. They're like, how
Yeah,
can you
of
put so
course.
much in one room? How can you do so much when everybody else charged me separately for every little
For
thing?
every little thing, yeah.
And you just included as part of your assessment
Mm-hmm.
and included without a problem. Why is this model so different?
Yeah.
And it is because of the membership. And so they're very happy.
Okay. So you charge the membership. What other things might people expect to have to pay for when they're at your clinic?
Oh, sometimes if we order labs that aren't on the regular screening panel, if there are additional things that we need to draw, we would charge for that, but we charge the price that we're charged by the lab, right? So
Right.
it's a very low price. If we prescribe medications, they have to pay for those medications that we dispense, which are a discounted price.
And for myself, if I'm doing a procedure, all they pay for is that the medications used during the procedure. Why? Because that's medication still. So even though it's not being dispensed to them, it's being used during a procedure.
Sure.
I don't necessarily charge them for a suture, but it's just the cost of the medication that they will.
Hold on, you just kind of breezed over that. So stitches are free?
Stitches are free as long as you are a member. Many procedures, stitches,
Mole removal.
mole removal,
Wart removal.
That's all cryotherapy. So if anything is to be moved with a cold temperature, or if I need to cut it off, it's included.
Look how she's
Taps.
smiling.
Are included.
So the women's health is included.
Yes.
You talked about
Skin
skin things.
Mhm.
A lot of those conditions require multiple visits and treatment over time.
Mm-hmm.
So that's another way you offer value.
Mm-hmm.
Yes, because
They're not paying a copay every visit or paying for the visit each time, right? Because it's just included in the membership.
Right. But if someone has, for example, 20 skin tags, I'm not going to remove all 20 and then send you home with discomfort,
Mm-hmm.
mainly itching all over. Why do that when you could take 4 at a time?
Mm-hmm.
And if you're a member, we have time.
Okay.
So people really like it and they don't feel stressed just
Yeah.
because they want to feel better about themselves.
Right.
So your patients can generally feel comfortable bringing up whatever's on their mind
Yes.
without having to worry about it getting really expensive without them knowing.
Right.
Very expensive very quickly
Yes.
without them knowing.
Yeah.
That's the other thing that they remind me. Juana, you could actually give me the price of things.
Yeah.
My other doctor couldn't.
Yeah.
I just get a bill. A
Well,
really
it's
big
true
bill.
though, because when you're working in other environments, you don't know what's going on, how much it costs. You just know what service you're providing, right?
Right.
I mean, I know that from experience. So this in this setting, I can just look it up, or I can text somebody and say, "Hey, how much does this cost if I'm going to give this to a patient, or how much does this cost if we're going to do this?" And I can tell the patient right there, it's going to cost this much to draw your labs. It's going to cost this much if I send you to do an ultrasound. It's going to cost this much to take these meds that I'm giving you.
What about that when you have to send patients for something that's you can't provide within your 4 walls? You just mentioned ultrasounds,
Yeah.
X-rays, that sort of thing. Do you just hand them a prescription and send them off to go figure it out on their own?
No, we have certain places that we know have set prices for things. So we generally try to either make them an appointment or give them the name of the place so they can make an appointment at their leisure. But we try to give them the price ahead of time so they know how much it's going to cost.
Going back to some of the differences between what you do and what's done at a typical family doctor visit anymore, how does your first visit with a new member compare to what they might expect going to any traditional doctor they're seeing now?
Oh.
Doctor or provider they're seeing now?
Well, first, there isn't someone else rooming them and taking their
Yes.
vitals.
Yeah.
It generally is me. And I start off with a conversation. I get to know them first.
Mm-hmm.
Second, we do a complete review of systems. They don't just check a box on a sheet of paper down the line and then hand it to somebody.
Mm-hmm.
No, they're getting to know me and I'm getting to know them.
Mm-hmm.
So we take the time to do that. And sometimes it takes
A long
45
time.
minutes to an
Yeah.
hour, and that's okay. I set aside about an hour and 45 minutes to 2 hours for each new patient.
Mm-hmm.
Then, of course, I do their complete physical, and we go over medication, side effects, adverse reactions, and then follow-up. And, of course, their complete plan of care. And that surprises them. So they like the time.
Mm-hmm.
So whereas you might be a new patient somewhere else, they could generally give you 30
30
minutes to 45 minutes if you're lucky. And
And
they
it's
do
not 30 minutes with the provider.
no. So you get to see a medical assistant, maybe a nurse, maybe not. You get to check off little boxes on a piece of paper, and then someone enters that in the computer, or at least should communicate with a physician or NP, and then you get your physical, and it's only a targeted physical. So it's very different.
Are you doing something more broad? Are you actually laying hands on people like
Mm-hmm.
the old-time doctors did?
Well, that's one of the funny things. My patient says, "You actually touch my feet." I'm like, "Yes, I actually during an intake exam, I will check their feet."
Mm-hmm.
And he said, "My doctor has never done that."
Yeah.
I'm like, "Well, this is different."
Yeah.
But
Why
so
would you check someone's feet?
many reasons. One, I want to know about whether they have any sores, any hygiene issues, whether they have any cardiovascular, athlete's foot, cardiovascular disease. It gives you a clue into the
Poor
human body.
circulation. Yeah.
Mm-hmm. So of course I explain this during the physical. I explain every step. I warn them what I'm going to do before I do it.
Mm-hmm.
They really like that.
Mm-hmm.
So Jennifer, so far this year, how has the road to where we are today? How has it been?
I think it's been great. I mean, I think I was really worried about doing something new and different in addition to what I already do in life. But this has been very good for me because I can see patients at my convenience, and there's nobody on my back saying, go faster, or do this or do that, or do it. You're not billing right, or you're not coding right, or you're not. So I really like that a lot. I can spend the time with the patients that I need to spend and not have to worry about all the other things that are going on. And I can see them on Sunday if I want, and I can see them on Saturday night if I want, and I can see them on Friday night if I want, and there's no office hours or somebody, there's no staff there to help you. It doesn't matter because it's just me, right? So that's very convenient for me.
I like that I'm my own boss.
Yes.
Cheers to that, sister.
Cheers to that. We are our own bosses. And along those lines, we can do what we want, right? What did we do today? We went and walked for suicide, community outreach. We also this year went to the college and did those sports physicals, right?
We did over 66 physicals.
Yes, for free.
For free, for the community.
So there are things that we can do because we're our own bosses that we can't do in other situations. And I like that. We've missed you guys. Thank you for joining us for another version of Coffee Clinic and Conversations. We hope you enjoyed our conversation today as we celebrate our 1-year anniversary at Dunes Family Clinic. Don't forget to like our post and share it, and feel free to contact us if you guys need